here at Pure Plastic Surgery with our weekly check-in. We go over different topics in plastic surgery and I get to answer your questions. Today we did it a little bit earlier than usual, but if you guys put I know that some of the questions were placed since yesterday, so I'll get to those. And if you have more questions throughout the day, just put them in the stories and I'll get to you later today, because I know you're used to a little bit later during the day. But today we're going to be talking about Vaser. Why are we talking about Vaser? Because a lot of people are asking if I do Vaser. The short answer, yes. So what is it, and who's a good candidate and who would benefit from it? So we'll go over what's Vaser, and then I'll get to answer your questions, okay? So Vaser, it's really an acronym for what the device is, or what the device does. So the letters go over vibration, amplification of sound, energy at resonance. So basically, it's an adjunct to liposuction, and it provides ultrasound energy to break the fat, coagulate the blood vessels, so it decreases blood loss, and it promotes skin retraction. So basically, it goes through these 4 steps. That's basically the steps for the Vaser. It's done through the same incisions as liposuction, so no large scars or anything like that. The first step is, like any liposuction procedure, infiltration. Why infiltration is so important with Vaser? Because we need to put a little bit more to mess in fluid than we do for regular liposuction. And the reason for it is because the ultrasound energy uses those bubbles or droplets of fluid to amplify the energy and break the fat. So infiltration process in any liposuction procedure is useful for decreasing blood loss, but in the case of Vaser, it's a combination of decreasing the blood loss but also amplifying the energy to break the fat. So the first step is infiltration. Second step is fragmentation. So after we infiltrate, and we infiltrate, like I mentioned, a little bit more to mess in than usual, we put the cannula in, and the cannula is connected to the Vaser machine, and this cannula vibrates, and that's why the vibration part vibrates and transmits the ultrasound energy, which then, using the infiltration, basically fragments the little droplets of fat, okay? So the fragmentation is the second step. The time, there's a direct correlation between the amount of fluid that we put in and the timing of the Vaser. So usually about 10-15 minutes of Vaser in the front or in the back, and depends on the areas. On the arms, it's going to be less time because it's less fluid. So it goes directly with the amount of fluid that we're putting in, how long is the time that we're breaking that fat, and basically creating a liquefied fat in order to then the next step, which is aspiration. So you don't do Vaser alone, you have to aspirate the fat or get it out. And that's when we do regular liposuction. In the case that I do, it's called PAL, or pulse assisted liposuction, because I use a device that vibrates and kind of breaks that fat that is remaining there and aspirates that fat that has been fragmented with the ultrasound energy. And the last step is, in the next few months after the surgery, is the retraction. So the good thing about Vaser is, one, it causes fragmentation of the fat without breaking that network of collagen that forms our subcutaneous system, which is that network. When we're doing just like regular liposuction, we have to break it because it's a mechanic in and out of the cannula. So when we are breaking that collagen system, we also kind of traumatizing the retraction of the skin, because the retraction is based on those collagen fibers, okay? So with Vaser, because we do a less traumatic breakage of the fat, that system of collagen is preserved, and the ultrasound energy also stimulates more collagen formation so we can get skin retraction, okay? So this is the last step, and that's gonna take months. It's not that you're gonna see the retraction immediately, but that healing and that collagen formation continues to build up over the next few months. 3-6 months to get that skin to retract, okay? So bottom line, what's the important? decreases tissue trauma because that tissue fragmentation is not done mechanically like with regular liposuction, but just fragmentation of those globules of fat. And because that fragmentation is done less traumatically and also coagulates the blood, we see less blood loss, less bruising, less swelling, okay? So your recovery is better. Therefore, less discomfort, less pain in the initial post-op period, and increases skin retraction. So I do recommend Vaser for any liposuction procedure. I think it's a great adjunct. I think that the energy that is provided is very, very helpful, not only for the recovery, but also on the results long term. And it can safely be combined with fat transfer. So there was some concern initially regarding, okay, so you're breaking that fat. Is that fat viable to then inject it and get a good viability of the fat when we're doing a BBL? The answer is yes. This has been looked into because it breaks the fat, but it doesn't kill the cells. And that has to do with the energy level that we're using when we're using the device. And it's very important that you go to an experienced person using Vaser combining with BBL, because there is some adjustments that you have to do when you're doing it, so you break the fat but the cells are intact, or that cell capsule or membrane is intact, so the cell is alive to then be transferred and survive. Okay, so lipo 360, it can be done not only in the torso, but it can be done in the extremities and the chin and other areas as well. You can combine it with BBL. Okay, very, very commonly. So again, for the question, do I do it? Yes, I do it very regularly. It is an added cost, so it's up to you if you add it to the procedure or not. But if you are interested, just let your coordinator know, and they'll give you a quote to add it to your procedure. I'll get to some questions now, so if you guys have them.
Yes, we have a lot of questions.
Okay.
5 months out from skin removal surgery.
Okay.
Anything I can start doing to help the outcome?
So if you're 5 months out, and you don't have any open wounds and the recovery went well, you are good to start working out. I think that combining your results with a healthy lifestyle change, meaning exercising and diet, is going to be super important to maintain your results. Whenever we remove that skin and tightening, especially with a tummy tuck, if your muscles were separated with a diastasis and brought to the midline, but your muscle itself is thin, you're not going to have good tone. So you may feel some bulging still, a residual bulging in your abdomen. The only way to straighten that abdominal wall is by doing core exercises, and that's definitely just going to improve the results by making your flatter.
Okay. Is there a certain weight or BMI required for mommy makeover?
Yes, very important. So my max BMI is 33.5. And why that number? So above 35, I don't think that you should be having any elective procedure. A BMI above 35 puts you in an obesity class 2, which makes risk of surgery very high. And what are the risks that we're talking about? Infection, blood clots, and the blood clot can travel to your lungs and cause a pulmonary embolism that can be fatal. So this is something that you shouldn't even consider having an elective procedure, aesthetic procedure, if your BMI is above 35. Above 30, so between 30 and 35, you're still in obesity class 1, but if you're closer to 30, the risks are significantly lower. And what are the things that I do to decrease the risk, especially of blood clots? I'm going to put you in blood thinners if that's the case. If you're above 30, and between 30 and 33.5, close to 30, but still not below 30, I'm going to put you in blood thinners if you're having a mommy makeover or a tummy tuck. If you can get below 30, that's the best. Then the risks are a lot less: infection, wound healing, blood clots. But I do have a lot of massive weight loss patients, and I do understand that sometimes getting that BMI to less than 30 with the excess skin is very hard. And that is why I give you a kind of a buffer zone up to 33.5.
What's a crescent thigh lift?
Good question. So thigh lifts, we have different kinds of thigh lifts depending on where is the excess skin and where do we need to put the incisions basically. So a crescent thigh lift, basically, if we have here thighs, right? If you have excess skin just in this area here, we can do an incision which is just in the groin and kind of pulling the skin up. I do combine a crescent thigh lift with liposuction, so all of this is liposuction and then excise basically this part here and pull this up, and the incision is hidden in the groin. Not everyone is a good candidate for a crescent thigh lift because sometimes with massive weight loss we have excess skin that extends up to the knee. In those cases, the incision is not going to affect much of the distal thigh or the thigh that is just closer to the knee. It will just affect the upper inner thigh. If you just have excess skin there, then you're a perfect candidate. If not, then it will be basically like a T incision. So this one here, and an incision that goes just in the middle here, connect all the way to the knee, okay? Or just proximal to the knee there, and that takes care of the excess skin that is in the distal thigh.
Do you do implant exchange, and would you be able to do high profile?
Yes, I do implant exchange, high profile, low profile, it's up to you. I go by what your goals are and your measurements. I don't usually put high profile implants when I'm doing a breast lift with implants, but if you have implants and the lift is not the distance between your nipple and your neck is not too long, then the risk of having nipple necrosis is not that high. So I could put a high profile implant with an implant exchange. It all depends on your measurements and your goals, but it is something that is very possible.
Will a person with a recent tummy tuck get more swelling after lipo to the stomach area?
Depends on how long was your tummy tuck. So you may experience, after a tummy tuck, you may experience swelling up to a year. If you do, I can do a liposuction procedure 3 to 4 months after your tummy tuck. So there is going to be some residual swelling still there. So you may see swelling again after the liposuction, but I think it's just a little bit more. I don't think it's significant enough for you to wait the whole year, but up to you. If you want to like be off of that healing period and make sure that all the swelling was resolved after your tummy tuck, then the best thing to do is wait a year.
Does Vaser reduce the risk of fibrosis?
So Vaser is actually good if you have fibrosis. So the risk of fibrosis does not increase with Vaser. And if you had prior liposuction and have fibrosis, I recommend Vaser because of this fragmentation helps break that scar tissue more gently than just mechanical liposuction. So I think it's a very good add-on to consider if you have fibrosis from prior lipo.
Do you do awake tummy tucks?
No. And no one should do an awake tummy tuck. So when you're doing a tummy tuck, incision goes from hip bone to hip bone, and you have to elevate all your skin up to your chest bone. You don't want to be awake for that. You have to be sleeping, and also we want those muscles relaxed enough that you can tighten them up. And the only way to achieve that relaxation of muscle is with general anesthesia, to have the muscles paralyzed so I can repair them. So no, and if someone is talking about that, I would run away from that person.
Yeah.
Don't
No.
advise. Do not advise. Yeah.
Can you do lipo 360 with a tummy tuck? No BBL?
So I don't, the reason why I don't combine lipo 360 with tummy tuck is 2 main reasons. Safety is the most important one, and also regulations in the state of Florida. So let's go with the first one, safety. So like I mentioned, when I'm doing a tummy tuck, I have to elevate all the skin from the lower belly up to the xiphoid bone. Therefore, the skin in the center of the belly is surviving from the blood vessels that go through the fat. So if I then go ahead and do liposuction in all that area, you may end up with wound healing problems, skin necrosis, or the skin dies, and it can be very, very, it can be a very big problem, because then you have a big wound that takes months to heal, and then end up with a scar. So I don't recommend combining those two. The other reason is because I operate in an office-based facility, there is some regulations by the Department of Health here in Florida that I can do only 1 liter of liposuction when combining it with an open procedure like a tummy tuck. So I think that it's best to just do the tummy tuck. I do liposuction with a tummy tuck in the areas of the waist and the flank. Have that heal, and then 3 to 4 months later we can do a lipo 360 and your results will be a lot better and safer.
Do you do breast lift and fat transfer to the breast?
I do. It is not a very common procedure that I do. The reason for that is there are a lot of limitations of what we can achieve with fat transfer to the breast, and I think that's the biggest misconception that we have with breast fat transfers, sorry. People think that a fat transfer to the breast is going to be similar to a BBL, that you can achieve a very full and a high volume transfer. The reason or the reality is that that's not the case. Fat transfer to the breast is very different from fat transfer to the buttock and hip, mainly because of the blood supply. The blood supply in the buttock is very rich, so we can inject high amount of fat and a high volume of fat and it survives. In the breast, there's not a lot of blood vessels like in the buttock. So when we transfer those high amounts of fat to the breast, they don't survive. So you can achieve maybe a half a cup of size improvement or 1 maybe, but you won't achieve that fullness that you can achieve with an implant. Is basically adding volume but very natural look. It's not going to give you that roundness and perkiness that you are looking for like with an implant look. It's never going to look like that, okay? So that's 2 things. And the third one, and most important, fat necrosis in the buttock, nobody really cares. Lumps, bumps, maybe you may see it, may not. But if you have lumps and bumps in your breast, then you would have to go through mammograms, ultrasounds, biopsies to rule out cancer. So it's just more of a hazard for the long term when we're dealing with fat necrosis in the breast. So things to consider. I do think it's good for people that are considering implant removal and don't have a lot of breast tissue, so we can combine it with some fat transfer to give you some volume without the implant.
Last but not
Please.
Let's go. Do you recommend Vaser when doing lipo during procedures like tummy tucks or arm lifts or thigh lifts?
I don't think that it's needed in those cases because I'm doing an excision, so I don't think the added cost is worth it for you. I do think that it's very beneficial when just doing liposuction to get that skin retraction. Okay guys, thank you so much for all the questions. Willie, stop it. I will see you guys next Tuesday tips. Thank you so much. Have a beautiful week.